We as oral and maxillofacial surgeons are the go-to for the full mouth treatment experience. We are able to provide all the solutions for full mouth restoration under one roof in this practice. At our practice, we're able to deliver predictable results from the simplest of cases to the most complex cases. The procedures involved in dealing with both full mouth rehabilitation and reconstruction range from the simplest of procedures, which may be the removal of multiple teeth and the placement of a maxillary denture or mandibular denture, to what is commonly known as overdentures, which are basically implant-supported dentures that are removable but being held in place by permanent implant fixtures, or going to full mouth hybrid or fixed prostheses, which are basically implant-stabilized bridges which are being held in place and are not removable and are permanent in nature. Here at this office, we offer consultations involving imaging and the discussion with models, showing them the different options that are available and how those options would work and what the different advantages and disadvantages are with those options and the costs involved with those options. Your first visit will include a consultation visit, at which time we will take diagnostic images, often involving a CAT scan. The CAT scan will give us the information necessary to properly treatment plan your surgery. We will work in conjunction with your dentist or a restorative dentist that we work with regularly. We will begin the treatment planning and set up your surgical appointment, at which time you will come into the office. We will be putting you to sleep via intravenous sedation. The surgery will be completed in a relaxed and comfortable environment. You will wake up at the end of the procedure about 2 to 3 hours later, and you'll leave here with a smile.